there's so much stigma and fear around the diagnosis. It's very different than being diagnosed, say, with high blood pressure or diabetes, even though the medical implications of HIV may not be as severe as something like diabetes. But it's an overwhelming diagnosis. Like, you'll hear people say HIV or cancer. You know, they're lumped together like these life-changing diagnoses. Whereas cancer often is a life-changing diagnosis, HIV doesn't actually have to be. But as with many things, if you're terrified by a diagnosis, you're much less likely to seek care for a host of reasons. I mean, it may just be that you're not able to handle the diagnosis, or you're overwhelmed, or some element of denial kind of creeps in. But there's also more sort of obvious pathways that lead people not to link. So a lot of our patients who are being diagnosed with HIV are struggling with other issues in their personal life. Often they're struggling with homelessness, addiction. Psychological issues are often present. We see a lot of patients who are really struggling with their mental health. And so if you can imagine in that circumstance, like if you're struggling with meth addiction and homelessness, and then you're told that you're HIV positive, that may be overwhelming, and you may find that you're